Hi, and thank you for having me today. Can you see me okay? Can you hear me okay? My slides showing okay? Wonderful. Okay, so I'm joining you from Seattle, Washington, and I currently work as a supervisor for medical interpreters and a medical interpreter myself. Although in my heart, I'll always be an English teacher. And so today I'm here to talk about the language of the pandemic. Some days it feels like the pandemic has just started, and then I realize it's been 2 years. And of course, the language has changed for all of us. I think I'm especially conscious of it because I work in healthcare currently, but I'm not the only one who has noticed. And Olga has mentioned dictionaries, but actually this is what I'm here to talk to you about, or at least this is the framework for my talk today. So I don't know if you know, but I know thank you. My background is my snoring dog. I have a good microphone, so you do not hear her snoring. But yeah, many dictionaries and organizations worldwide have a word of the year. And so Oxford Dictionary is not an exception, or rather Oxford University Press. It publishes the Oxford English Dictionary, and then lots of other dictionaries. Every year announces the Oxford Dictionary's UK word of the year and the US word of the year. Sometimes these are the same word. So it doesn't have to be the word that was necessarily coined or created in the last year, but it does need to have become kind of prominent in that time. And interesting thing is that they don't always include the word of the year in the dictionary. So that's really interesting, I thought. So basically, they have these selection teams made up of lexicographers, consultants, marketing team, publicity staff. And for 12 months, they kind of look at newspapers, at publications, online, offline. They look at social media. Regular people can also submit their suggestions through social media, and they're considered. But basically, they look at like 150 million words every year to try and figure out what the word of the year will be. And so basically, they look at all of this information and then they choose a word of the year. And this is something that it's a word that is used very frequently, but it's also something that occupies the minds and the hearts of everyone in the English-speaking world in that year. I think they have a separate word of the year for other English-speaking countries, not just the UK, the US. Today, we'll just look at those two. So on the left in the column, you'll see the words of the year for the last 10 years. And these 10 years, as you can see, I actually had to look some of these up. So I had to look squeezed middle myself. So this isn't anything to do with anybody being squeezed. It's about the middle class that has less economic power or spending power because things are becoming more expensive, but their salaries aren't keeping up with inflation. Omnishambles was another word I had to look up. It's basically omni. It's like every, like omnipotent, right? Being able to do everything. So omnishambles and shambles, it's like mess or chaos. So omnishambles is basically when everything is going wrong, when it's a complete and utter mess, right? And then in 2013, the word was selfie, which I think, many people kind of had a lot of feelings about the word selfie being included in the Oxford Dictionary. Then we have vape, which of course is, a way of smoking. 2015, word of the year was not even a word, it was the emoji. As, cell phones and social media became ever more present in our lives, it became more and more prominent. Then, I probably won't go over all of them. And then something happened in 2020. So I see you're having some, you're sending some suggestions. So remember, 2020 is not this year. We're in year 2021 now, and 2021 is almost over. So we're almost to 2022. So in 2020, Olga guessed correctly, there is no word of the year. So instead, what they did is they released a report that's called Words of an Unprecedented Year. So they said, you know, the year 2020 just had so much going on. There were so many catastrophes and large-scale events that they were just unable to pick one word. And so they released the report. It's available, like it's free. It's a PDF document. I think it's about 20 pages. I read through it to prepare for this presentation. There is a link at the bottom. But if you just Google, you know, Oxford Language Word of the Year, the official website will have like previous words of the years. It'll have that report and many of the words that I will show you today. So some words for 2020 are here. So you can kind of guess what has been on people's minds in 2020 in the English-speaking world, right? So we have bushfire from Australia, where they've suffered this large-scale natural disaster. We have impeachment from here in the US, coronavirus and lockdown soon happened, social distancing, cancel culture, which refers to people who do something on social media or elsewhere that is perceived to be, you know, not acceptable to the majority of people, and this person is then canceled, meaning they're ostracized, heavily criticized, perhaps, you know, losing some contracts, etc., etc. BIPOC, which stands for Black and people of color, Black Indian people of color, and Black Lives Matter, of course, refers to a very large social movement that happened here in the US. Sorry, Black Indigenous people of color. Just had to correct myself there. So that was 2020, and actually some of the words from that report will be included in the rest of my presentation. And then 2021, I think some of the suggestions you were making in the chat, you got it completely right. So 2021 word of the year is vax, V-A-X. Sometimes it is spelled with W with two X's, although one X is more common. And so all of the words that can be derived from vax. So vax sites, which are places where you go and get vaccinated, vax cards. I know in Russia, people are using QR codes. Here, it's not as common. We mostly have good old-fashioned cards that we show you can get vaxxed. You become fully vaxxed or double vaxxed after you receive two doses of vaccinations. Anti-vaxxers are people who do not believe in getting vaccinated and don't want to get vaccinated. Unvaxxed, meaning unvaccinated. And then the last word is vaxxy. Can anybody guess what a vaxxy is? I'll give you like 10 seconds to post your guesses in the chat because I don't want to hold the presentation up. So person who has a vax is vaxxed, or maybe a vaxxy if they're, or a vaxxer if they support. So a vaxxy, it's like a selfie, except it's when you, it's a picture of you getting vaccinated. So this is my vaxxy. This is me getting my booster, a third shot of Moderna. So I took a vaxxy as I was getting my shot, right? Because I wanted, you know, I wanted to show that it's not that scary and it's fine. So let's talk about some other words that entered our vocabularies starting in 2020. So one word or other phrase is PPE. So even before the pandemic, I was a medical interpreter, right? I worked in healthcare. So I knew that PPE stands for personal protective equipment. So these are things that people work to protect themselves from whatever, you know, whatever they need protecting from. In healthcare, these things are generally gloves, masks, maybe special gowns or eye protection, right? But of course, as soon as the pandemic started and we had all these different requirements, everyday people started talking about PPE. People on the news started talking about PPE shortages, PPE prices, etc. So here in my state, and I have to say that in the US, things are very, very different based on the state you live in and even the city you live in. And unfortunately, the whole pandemic has become very politicized. And so even in Washington, which is considered to be kind of a liberal state, things are very different in Seattle versus in more rural parts of the state. So I always say we live in Seattle, we live in a bubble, where I always feel safe. Not the case everywhere else. But anyway, here in Seattle, we started masking everywhere. Masking is now used as a verb, right? So you need to be masking. We should be masking. Another word for this is face coverings. So they're required in most indoor spaces. They're also required in crowded outdoor venues. So here in this picture is me with some family members. We are at a baseball stadium. As you can see, it's outdoors, but we are still wearing masks because it's pretty crowded and it's required anyway. So at some point, we all believed that as long as we keep masking, our state will be reopened, meaning everything that was closed so far, things that were canceled, will go back to, eating out in restaurants, attending concerts, and so on. Unfortunately, like I mentioned, things became very heated here. So even something as wearing a mask became almost a political choice. And so people engaged in mask shaming. So mask shaming can be directed at both people who are not masked, right? And you're saying like, hey, you should really mask up. And also to those who do choose to mask up, and people who don't think it's the right thing to do would mask shame them and say like, hey, why are you wearing your mask? You're, it's not helping anyone. You're being stupid. So like here you see a picture, it says mask up to open up Washington. So this is some ads that you can see, on buses, on TV, on social media, that's kind of getting people to wear masks more. Another thing that happened is isolation. So the term that started being used here is social distancing. By social distancing, they meant, actual physical distancing. So they decided that 6 feet, which is just about 2 meters, is a safe distance for you to be at when you're around other people. So even if you're wearing a mask. And so most shops and other public places. So you see, this is a picture I took at a local supermarket where you see these crosses. So it kind of shows you like where you're supposed to stand as you're waiting in line. You see signs everywhere that talk about 6 feet. But this social distancing became both literal, right? We maintain actual distance from each other, but it also became figurative. In various states, in various stages of the pandemic, there were lockdowns, stay-at-home orders. And so because I work in healthcare, I'm an essential worker, I continued going to work. Nothing changed for me, right? But for many people who were, for whom school was canceled, for whom work was either canceled or changed, they started quarantining. So some people would self-isolate or self-quarantine because the government told them to do so, or maybe they've had an exposure somewhere. And so now they need to self-isolate for 14 days, or maybe they returned from traveling somewhere. Some people knew that, okay, I'm going to stay at home for this period of time, whether it's 2 weeks or 2 months, or who knows how long. If I stay home, I can't have people over. Right? My friends can't come over for a party. I can't go and see my friends. So either I quarantine alone or I quarantine with someone else. And so that's how quarantine pods or bubbles were born. So people in your quarantine pod are either either the people that you actually quarantine with, that you stay in the same house or apartment with, or maybe these are the people that you like only see them. You don't see anyone else. And you know that you and them are kind of following the same, taking the same precautions. They don't go outside to work. Their kids don't go to school. So it's safe to see them. Here's what happened to work. So as you were, I caught some of the presentations, you were talking about teaching on Zoom, right? And trying to engage students on Zoom. So here, many people started working remotely. And, for me, I go to office every day, and some days when it's 5:40 a.m. and I just woke up and it's dark and cold outside, and they think, why do I have to go to the office? I want to stay home. It seems fantastic. Right now, I'm wearing my yoga pants and you guys can't see them, right? It's amazing. I'm so comfortable. Have to wear real pants, or I guess I should say trousers, when I go to work. And yes, working in your PJs may seem like a dream, but for people who had kids, who had, other commitments, this became very hard as they struggled to juggle multiple commitments, that, they had kids that suddenly couldn't go to school, and, you had to take care of them. And at the same time, you have to work and have work meetings. And with nonstop Zoom meetings came Zoom fatigue, which is a special term that is coined how tired you feel after a Zoom meeting. So much more tired than from a real life meeting, because you have to focus harder to be able to see people. When you're having connection problems, when your colleagues have connection problems, you have to stare at yourself. It's really hard. Another issue that happened with Zoom is Zoom bombing. So this came from photobombing. So I guess you can kind of say that my dog is photobombing me. So photobombing is when you take a picture and suddenly somebody pops up in the background, either intentionally or unintentionally. So Zoom bombing mostly happens intentionally. And it's when somebody crashes a Zoom meeting just for the sake of being disruptive, right? So somebody crashes a work meeting or a class, and they may show some images that are super inappropriate. So people started taking Zoom much more, like Zoom security, much more serious. People also learned the art of waist up fashion, right? This is what I was just telling you about. You'll see a screenshot there from a news report where a news anchor went on the news, and I guess he didn't realize how low the camera went. So I don't know if you can see, the image is quite small, but he's not wearing any pants. He's just sitting there in his underwear, and he didn't realize. So many cases like that, right? And then muted, of course, the whole drama with muted. I don't know if this ever happens to you, but somebody is trying to talk and you're like, oh, come on, you're muted. Just unmute yourself. Just there's a microphone, click on it. No, you're still muted. We can't hear you. Nobody can hear you. Please unmute yourself, right? I saw many jokes that say, actually, you're muted should be the word of the year of 2020 and 2021, right? Not wax, not anything else, but you're muted. As far as, so some people who are either very fortunate, or you could say unfortunate, to be able to work remotely. However, while working from home, WFH is a very common abbreviation now. I literally saw an ad on the bus. I wish I could take a picture. I was driving at the time, but it was an ad for a company where you can buy homes. Like, it's a company, like a real estate website, right? And so they were saying WFH prices without the WTF, WFH spaces without the WTF prices. So anyway, unfortunately, not all jobs can be done remotely. So, for example, people in healthcare. People in healthcare were often referred to, as well as like paramedics and police officers and firefighters, They were referred to as frontline workers, being on the front line of the pandemic. People often showed them the appreciation, like hospitals and fire stations and police stations received food donation. There was a whole thing, I'm sure you've seen on the news, they did that in Italy. They did it here in Seattle for a while, where, you know, at, I don't know, like 8 o'clock every night, people who lived in areas around hospitals, they would get together and they would like clap, or they would bang pots and pans. Well, that finished, you know, I think when people realized, okay, we cannot do it for the rest of our lives. Clearly the pandemic is not going away. So that was over. Other examples of essential workers, this is what we say here in the US. In the UK, people say key jobs, included grocery store workers, supermarket workers, farm workers, public transport staff, delivery drivers. And many of these jobs are really, you know, the pay is really low. People don't have a whole lot of protection like health insurance or even paid leave, which of course, if you're sick, right, if potentially you have COVID, you don't have paid leave. So if you're feeling more or less okay, maybe you don't want to take time off because you can't afford to. And of course, if you're at work and you're sick, you get more people sick. So this is kind of a vicious circle of people already being more vulnerable to infection outbreaks because they have to work, right? And by having these, you know, kind of miserable conditions, they're more vulnerable to get sick, but also to get others sick. So when we celebrate essential workers, it shouldn't just be healthcare workers, it should be everybody who makes it possible for us to kind of eat and travel and so on. Moving on to shopping and dining. So again, depending on a state, depending on what's happening with the disease in a particular state or county, which is kind of like a regional division inside of a state or a city, restaurants and other non-essential, like not grocery, like clothes or makeup or something else, they either had to close to customers altogether or they had to change the way they work. So for some restaurants, that meant you could only get a takeout. You couldn't come in and eat. So when they didn't have that, when you couldn't come in and eat in the restaurant with no indoor dining, they set up tables on sidewalks, which is nothing new if it's the summer. What if it's the winter? What then? Well, you see in the middle picture there, we were eating in a restaurant where they used the sidewalk and even part of the road to build kind of like these pods where you could put in heating and you were protected from the rain, because here in Seattle, it rains all of the time, right? So you want to be in a covered space. I actually saw one restaurant, they had greenhouses. So, you know, the greenhouse that you have at the dacha that you grow tomatoes and cucumbers in. So they actually had those that they used for people to eat in outside. And then for both restaurants and for shops and for other services, you had no contact delivery where they just left things by your door. You had curbside pickup. You see this in the third picture from the left, where you drive up to a restaurant or a store and they just kind of bring it to you, or they may bring it to the window, or they may put it in the trunk. On the very right, you see this is an actual poster from a vet hospital where we take my dog. So they've, since the beginning of the pandemic, they only had curbside service, which means I drive up there with my dog, I call them and I check in and I say, hi, I'm Yulia, I'm here to, with my dog Jackie, you know, I have an appointment or it's an emergency, whatever's going on, right? So then a nurse would come out to the car, get my dog, and take her to, just checking, and take her to the vet. I can't come in there. And then, you know, once they're done with her, they would call me and bring her out to the car. So That's curbside service. Sometimes you're able to drop them off. So in another vet hospital, I'm able to like bring her into the hospital, leave her there, but still I can't go back. So yeah, even in human hospitals, right? Not vet hospitals. In the past, pre-pandemic, you were able to come in with as many people as you wanted. Now you mostly cannot. It depends. It changes. Sometimes you cannot have any visitors. So that is terrible. Like imagine being in a hospital for days, weeks, or even months and not being able to have any visitors. That is terrible. So I'm very glad now the rules have changed. Visitors are able to come in. They have to show either proof of vaccination or they have to show a negative COVID test. And this is for the safety of staff and of the patients themselves. So is this now the new normal? And I know things are very different, right? I realize things are different in Russia. I visited Novosibirsk just this summer. And of course, I had my mask on and I kept, when people came too close to me and they weren't wearing a mask. I know that I live in a bubble, both Seattle bubble and healthcare bubble. And I know sometimes I look at people, my friends, and other people I know in other parts of the country or other parts of the world. And it looks like the pandemic's never happened, right? And so I wonder, will we ever go back to normal, right? Will we ever blow out candles on a birthday cake? Think about it. Blowing out candles on a birthday cake. So you're blowing all of your viruses and bacteria onto the cake that other people are going to eat, right? Are we going to ever be able to have potluck parties? A potluck party, just in case you don't know, it's when you bring, like when you have a party at work, at somebody's house, everybody brings a dish. So, that means kind of people eating the same food. And of course, with COVID, the concern is not that you're eating the same food. It doesn't spread through food as much, but it's mostly, having lots of people together unmasked, like standing very close. Or are we going to continue having Zoom parties? Like right now, when people retire at my place of work, they get a Zoom party. We can't share food at work. If somebody has a birthday or like right now, Thanksgiving is coming up, Christmas is coming up, we can't share food. You can't bring muffins, you can't bring anything unless it's prepackaged and store-bought. And even then, you're not supposed to eat it there and then. Will we ever shake hands again? Or are we going to continue doing these awkward elbow bumps, right? When you see people for a minute, you're like, oh, wait a minute, we're not supposed to shake hands. What do we do? Here is an awkward elbow bump. Here is a pretend hug. Here is an air kiss, right? So it's interesting to know, to see what's happening in movies and TV shows. So some TV shows that show, our time, things happening in 2020, 2021, they will show the pandemic just as it happens, right? They would show people wearing masks and all the other things that are happening. Some movies, even though they take place now, right, without saying specifically that it's 2020 or 2021, they look as if nothing happened, right? They're filming some other alternate reality. And so this is a screenshot of somebody's tweet that says, my current level of anxiety is watching movies from pre-COVID and getting stressed, everyone, and standing so close. So this happens to me too, when for a minute I forget, wait a minute, this movie is happening in like, I don't know, 2005. They're not real people, they're actors. Why are they standing so close? What's going on? They're gonna get sick. So yeah, this kind of concludes my presentation. I hope whatever happens, whether, however things are right now, I hope you stay safe. I hope you find a way to connect with your students, whether it's virtually or in person. I think I'm finishing a little bit early. So this either leaves time for a little Q&A or, whatever you decide to do. I'm giving you the gift of 4 minutes.
Can we say that COVID boosted new ethics development?
Anastasia, where is she asking? In the question, in the chat. Semina Anastasia. So
New ethics development. Well, you know, this is a really good question and a really big question. I don't necessarily think that it's new ethics. I think it's all the same ethics. So there are different questions of kind of morality and ethics that come up. One is having vaccinations be mandatory, right? So people have very strong feelings about it either way. People who think, yes, we should get vaccinated and you should get vaccinated. And if you don't want to get vaccinated, we will make you get vaccinated, right? And some people say, I will not get vaccinated. My kids will not get vaccinated and you cannot make me. This is my body. And so there's been, you know, both camps have very valid points. I know. So that's one kind of debate of ethics, right? Is it ethical to make somebody vaccinate? Is it ethical not to get vaccinated when you know it's also part of protecting the rest of, you know, the rest of the society? That, you know, there's that. There's also ethics of, you know, when you're sick, do you still go to work? What if you can lose your job if you don't go? Is it still ethical if, you know, if you lose a way of supporting yourself? Is it, again, because we're in healthcare, right? For us, the stakes are higher. If I get sick and I go and interpret for a patient and that patient gets sick, then it's a whole thing, right? I've endangered the life of a patient, potentially lives of other staff. So stakes are high. I have to stay home if I'm sick. So that's another ethics. And I think, of course, just being considerate and saying like, hey, I have the sniffles, like I have a runny nose. It's probably nothing. I'm pretty sure it's an allergy, but I'm not coming to your party because I want you to be safe. Or my husband tested positive. I'm negative, but I still want to make sure, you know, I'm not sick. So again, not coming to your party, or I'm canceling our dinner together. So I think it's the same, you know, same things as before. It's just that now they're more amplified. The stakes are higher.